Hi, I'm Dr. Sandeep Jha. I'm a liver disease specialist and a liver transplant surgeon, and I work as a consultant at Manipal Hospital, which is in Dwarka, Delhi, India. Today, we are going to talk about cirrhosis and what to do when you are diagnosed with cirrhosis or your doctor informs you that you are suffering with cirrhosis. Now, being diagnosed with cirrhosis is an unfortunate situation. However, with a timely management and right guidance, you can live a very fulfilling life even with cirrhosis. So, it is important to get the right guidance and right management for cirrhosis. Now, when you're diagnosed with cirrhosis, you can either be a compensated cirrhosis or decompensated cirrhosis. Now, decompensated cirrhosis is a condition where you are getting complications of cirrhosis. That is, you're forming ascites, you're getting blood in vomiting, you're getting jaundice, your limbs are swollen, and you're getting such complications. So you're classified as decompensated cirrhosis, and you require liver transplant to get over this condition. However, if you have compensated cirrhosis, that means you are not showing any symptoms of cirrhosis, but your doctor has informed you that your liver has undergone enough damage to classify as cirrhosis. However, you are not getting any symptoms related to cirrhosis. That state is called as compensated cirrhosis. And such patients can live to 5, 10, 15 years, and they can get cured of cirrhosis if they are referred for a timely liver transplant and if those complications are prevented or diagnosed at an early stage and they get a timely referral for liver transplant. So, what is the protocol for these patients? Now, cirrhotic patients are recommended to visit a liver specialist every 3 to 6 months. They should visit a liver specialist who will get a blood investigation containing a CBC, liver function test, kidney function test, a prothrombin time, maybe alpha-fetoprotein. The doctor might get an ultrasound done, which helps to image the liver and find out any liver cancer, or he might also choose to get a CT or MRI on basis of any suspicion. He might also like to get an upper GI endoscopy done to see if there are any varices which are at risk of bleeding so that it can be banded in a timely fashion. So this protocol is followed every 3 to 6 months in every patient who has cirrhosis, and they should visit a liver specialist every 3 to 6 months so that these complications are firstly prevented, or if they cannot be prevented, they are diagnosed early and the patient can be referred for a timely liver transplant. However, what usually happens is that initially the patients are very particular about their follow-up, but as time passes, they are lost to follow-up, or they do not follow up timely and eventually land up with complication a few years down the line and in a state of decompensated cirrhosis. So this should not be done, and it should be followed up every 3 to 6 months, and timely investigation should be done. So now, what is this strategy? What is the basic principle of management of such patients? Now, what we are trying to do with this follow-up is we are trying to prevent complication and diagnose these complications early. And with diagnosis of early complication, patient can be referred for a timely liver transplant so that the body does not suffer damage and the liver is changed as soon as the damage is extending to the rest of the body or extended to other organs of the body. And what are these complications? These complications are upper GI bleeding. So when you are following up with the doctor regularly, he has an opportunity to put you on beta blockers or do a upper GI endoscopy and do a timely banding so that these varices can be prevented from bleeding. If you are developing ascites in your tummy, then he can put you on a diuretic or a water pill that can reduce this ascites, or put you on a high protein diet which can prevent such ascites from forming. If you are having damage to your kidney or acute kidney injury or hepatorenal syndrome, he has the opportunity to stop your diuretics and put you on a high protein diet so that renal perfusion is maintained and your kidneys do not suffer damage. If you are having jaundice, he can put you on some medications that can relieve jaundice, or if there's any underlying infection, he can put you on antibiotics. If you are at risk of encephalopathy or you are developing early signs of encephalopathy, he can put you on some medication or some antibiotics which can prevent these complications from arising, or he can put you on some drugs that prevent constipation from happening, which is known to precipitate encephalopathy. And if you are at risk of developing liver cancer, then he can do a timely CT, MRI, or an alpha fetoprotein level, so that this is identified early before the cancer becomes big, and then the patient can be referred for a timely liver transplant. So as you see with these protocols, if you follow them up regularly, a patient of cirrhosis can live quite a normal life, and even there's a possibility that with a timely liver transplant he can win over cirrhosis and live a very fulfilling life in spite of cirrhosis. So if you think there's useful information in this video, then please like, share and subscribe to this video so that more and more people can benefit from it. Thank you.